Stability of hip joint. The hip joint is a very stable joint due to bony factors, ligamentous factor, and muscular factors. First of all, bony factors. The head of femur fit very well in a deep socket, which is the deep acetabular, and ligamentous factors. The capsule and the ligaments of hip joint are very strong capsule and ligament, especially iliofemoral ligament, which is the second strong ligament all over the body. In addition to muscular factors, the hip joint is surrounded by many strong muscles. Therefore, bony factors, ligamentous factor, and muscular factors, they make the hip joint is one of the most stable joints all over the body. Movements of the hip joint. The movement of the hip joint, since hip joint is a ball and socket joint, which move in 3 axes, polyaxial. Therefore, all movements can be done in the hip joint. Flexion, extension, abduction, adduction, medial rotation, lateral rotation, and circumduction. What are the flexors of the hip? Mainly, iliopsoas muscle is the main flexor of the hip, assisted by sartorius and rectus femoris. Sure, the muscles which produce flexion are the muscles which pass in front of the hip joint, and the muscles passing in front of the hip joint are iliopsoas, sartorius, and rectus femoris. In addition to adductors, all adductors except the ischial part of adductor magnus assist flexion of the hip from extension position. If you extend the hip, all adductors except the ischial part of adductor magnus, which produce extension of the hip. All other adductors produce flexion of the hip from extension position. Therefore, always remember that flexors of the hip are the muscles which passing in front of the hip joint. On the other hand, muscles on the back of the hip joint produce extension. Sure, the main extensor is gluteus maximus muscle, but usually gluteus maximus produce powerful main extension of flexed thigh, as during rising from sitting position or during going up a stair. Extension is assisted by these muscles on the back of the hip joint, which are the hamstrings muscle and the ischial part of adductor magnus. That is to say, the muscles attached to ischial tuberosity, ischial part of adductor magnus, and all hamstrings attached to ischial tuberosity. All muscles arising from ischial tuberosity lying on the back of the hip joint and assist in extension. Assist extension and during walking at the same level. During simple walking, the hamstrings and ischial part of adductor magnus produce extension, but powerful extension against gravity as rising from sitting position is the action of gluteus maximus. Adduction. Adduction of the thigh shown mainly by the three adductors: adductor longus, brevis, and the pubic part of adductor magnus. The main adductors are adductor longus, brevis, pubic part of adductor magnus, assisted by pectineus and gracilis. Abductors. Abductors of the hip, mainly gluteus medius and gluteus minimus, are the main abductors of the hip, assisted by tensor fasciae lata. Medial rotators. Medial rotators of the hip are anterior mainly by anterior fibers of gluteus medius and minimus. Medial rotation by anterior fibers only of gluteus medius and minimus, assisted by tensor fasciae lata. Therefore, take an arrow between abductors and medial rotators. Abductors and medial rotators. The main abductors and in the same time medial rotators are gluteus medius and minimus, and assisted in both adduction and medial rotation by tensor fasciae lata. In lateral rotation, the main lateral rotators sure are the 6 lateral rotators, assisted by what? Assisted by gluteus maximus and the sartorius muscle. Circumduction is combination of all previous movements. What are the main relations of hip joint? Remember in hip joint that anterior relation. The anterior relation is iliopsoas, separating the capsule of hip joint from femoral nerve and the femoral vessels. And posterior relation, sciatic nerve. Sciatic nerve is separated from the back of the capsule of the hip joint by obturator internus and quadratus femoris. Obturator internus and quadratus femoris. What is the nerve supply of the hip joint? The nerve supply of the hip joint are the same nerve supply of the muscles acting and crossing and passing in front of the hip joint, which are the anterior group supplied by the front of thigh, rectus femoris, sartorius, supplied by femoral. Medial group supplied by obturator. Posterior group of the back of the thigh supplied by sciatic. In addition to nerve to quadratus femoris. Here there is important point in applied anatomy. Pain from the hip may be felt in the knee. Why? There is rich nerve supply of the hip joint from femoral, obturator, and sciatic nerve, which also supply the knee joint. The knee joint is supplied by branches also from femoral, from obturator, and from tibial nerve and the common fibular nerves, which are branches from sciatic. Therefore, pain in the hip may be felt in the knee, and vice versa. And vice versa, disease in the knee may be felt in the hip. What is the arterial supply of the hip joint? Sure, from the posterior aspect in the gluteal region, gluteal vessels, and from the anterior aspect, medial and lateral circumflex femoral, which are branches from profunda femoris, and obturator artery. Obturator artery, which is a branch from internal iliac artery. This is the hip joint. Thank you for good listening and good luck.